Hello and welcome to this educational series called Welcome to Medicare. This program is presented by the Wisconsin Department of Health Services, which operates the Wisconsin State Health Insurance Assistance Program, or SHIP, a local public service for people with Medicare. Every state has a SHIP program. In Wisconsin, you can get free and unbiased help with Medicare from local SHIP counselors. You can download the slides to this presentation by clicking the link in the YouTube video description. This project is supported by a grant from the Federal Administration for Community Living. This program will provide an overview of Medicare and is divided into 6 parts. You can find this information in greater detail in your Medicare and You handbook, which is mailed to people with Medicare and can also be found on the Medicare.gov website. For easier understanding, you are encouraged to view the parts of this series in order. Welcome to Part 6 in this series. This section will include information about Medicare programs for people with limited income, tips to help you protect yourself and prevent fraud, and will conclude with a review and a list of available resources. Many people with Medicare can face challenges when it comes to paying for health care and prescription medications. In fact, we often hear of people who have to choose between paying for groceries or paying for health care or medicine. If you know of anyone in this situation, you will want to know about some important Medicare programs that can help. The following 3 programs may be of assistance to help people who have limited income. Medicare savings plans provide help from the state for people with limited income and resources. If eligible, your Medicare Part B premium will be paid for you. Some people also have their Medicare copays and deductibles paid as well, based on their income and assets. Extra Help is a Medicare program designed to help people with limited income and resources pay their Medicare prescription drug costs. People who qualify will get help paying their Part D plan's premiums, deductibles, and copays based on their income and assets. They will also have no coverage gap and no late enrollment penalty. In the last section of this series, we discussed Wisconsin Senior Care. This is another program that can help people with limited income. Again, the level of assistance with this program will depend on the person's annual income. This chart shows the eligibility guidelines for the benefit programs listed on the last slide. Although there are different levels for each of these programs, the chart shows the highest income and asset limits to be eligible for the programs. The limits shown here are current as of February 2026. If a person does not meet these limits but still struggles with health care or prescription costs, they are encouraged to contact a SHIP counselor for assistance. These income and asset limits change every year, and there may be other savings programs available for them. Each financial assistance program has different eligibility requirements. Click the links or call the numbers provided to learn if you can get help from these programs. If you need help, you can contact a local benefit specialist for one-on-one assistance. Protect yourself and prevent fraud. Medicare fraud and abuse happens, but there are a few important things that you can do to prevent it and to protect yourself. The Wisconsin Senior Medicare Patrol suggests several steps to take. Step 1. Protect yourself and others from Medicare fraud. Don't give out your Medicare number except to your doctor or other Medicare provider. Treat your Medicare card like a credit card. Watch out for identity theft. Be aware that Medicare doesn't call or visit to sell you anything. Be cautious of any offers for free medical services. Remember, if something sounds too good to be true, it probably is. And do pass it on. Share these do's and don'ts with friends and family. Step 2. Detect Medicare fraud by reviewing your Medicare summary notices. If you sign up for mymedicare.gov, you'll be able to access your personal Medicare information online. You're also encouraged to keep a personal health care journal where you can keep track of your doctor's visits and services. Compare your MSNs and other statements to your journal to make sure they are correct. The Medicare Summary Notice, or MSN, is sent every 6 months to people with Medicare. Be sure to review it when you receive it. It is not a bill. Check the name, address, and Medicare number for accuracy. Did you receive the service? Again, compare it to your healthcare journal. Be sure your claim is processed and paid. If an item is denied, call your doctor's office to make sure the claim was coded properly. If not, the doctor's office can resubmit the claim. If the claim is denied, you have appeal rights. The deadline to appeal is 120 days. And step 3, report any suspected Medicare fraud or abuse. If you notice something that doesn't seem right on your bill, the first thing to do is to call the provider to discuss your concerns. Be sure to gather your documentation, such as your personal healthcare journal, billing statements, and your Medicare summary notice. And if the issue isn't resolved, contact the Wisconsin Senior Medicare Patrol for free and confidential help. You can call toll-free at 888-818-2611. Part 6, Review and Resources. We've covered a lot of information during this 6-part series, so before we end, let's do a quick review of the coverage options you've learned about. Remember, there are 2 ways to get your Medicare coverage: Original Medicare or a Medicare Advantage plan. Original Medicare includes Part A and/or Part B, and you can add additional coverage such as a Medigap policy to fill in the gaps of Original Medicare. You can also choose to buy Medicare prescription drug coverage, or Part D, and/or senior care. Or you can choose to get your coverage through a Medicare Advantage plan, which will cover Part A and Part B services and supplies and usually includes Part D coverage. You may be able to add drug coverage to some types of Advantage plans if it is not already included. And again, remember that option for senior care. This concludes Part 6 of the Welcome to Medicare program. I hope this information has been helpful. This presentation was brought to you by the Wisconsin State Health Insurance Assistance Program, or SHIP, a local public service that provides free and unbiased help to people with Medicare. If you have questions about Medicare, you can call the Medigap helpline at 1-800-242-1060 or visit the Wisconsin Department of Health Services website to find a local SHIP counselor near you.